So I'm Dr. Ellie McGregor. My practice is Middle Path Integrative Pediatrics. If you've driven up and down Hendersonville Road a number of times, my practice is actually in the Ballard shops and offices, and it's just me and my physician assistant, Brandy. I want to tell you a little bit about why I started my practice. So I graduated residency about 20 years ago, and I got my first job in a little mountain town in Utah. And I will tell you, I was absolutely run off my feet. So I was seeing 35 patients a day. I did not pee. I did not eat. You guys can probably relate, some of y'all who are educators. I had a headache by the time the day was over. I didn't know who my patients were. I had a patient panel of 2,000. Let me tell you, no one knew in that practice who their patients were. So I did what I always do as a good little girl. I called my dad. And I said, Dad, this is what's going on. I'm supposed to see a patient every 15 minutes, and they will triple book me and then tell me I am running behind. And he says to me, he thinks about this for a minute because he's a smart guy. And he says to me, you know what you should do? Why don't you just sign a bunch of amoxicillin prescriptions and leave them at the front desk? That way, you don't even have to see anyone. And you're meeting your goals, right? Because the goal of the practice was what? Your restricted value unit. Who knows what a restricted value unit is? Yeah, I didn't either until I graduated. This is a number that is assigned to a patient, and each patient gets a value. And this is how most physicians in insurance-based practices are paid. So the more value that you have as a patient, the more money the physician makes, number one, and the more number of these restricted value units, not people, not kids, but the more number of these RVUs that you get in and out the door gives you what? A higher salary. So these practices are incentivizing what? Decreased patient care time, not listening, rushing people in and out the door, making sure that people are seen quickly, efficiently, and then gone. What they're not valuing is holistic care, personalized care, how much time I take with a patient, whether I get the diagnosis right, or even give the proper treatment, okay? I said to myself that night that I talked to my dad, that's it, I'm done. This is not what I signed up for when I thought I was gonna be doing medicine. I thought I was gonna be a healer, not an RVU producer, okay? And that's when I decided to go back to school and get my integrative medicine degree and do integrative pediatrics. So here I am. Fast forward a few years, I was working for a great company, doing my holistic thing, when what happens? Anyone know a company called Amazon? Anyone use them? Would you get health care from Amazon? No. I wouldn't either. They bought my practice. So I said, you know what? My family's in Asheville. I've wanted to have my own practice, and I'm going to do it my way, so here I am. And that's what I'm doing today. I'm offering personalized care that's holistic, complete, allows me to get to know my families and all of the rest, making sure that people are getting treated the way that I believe that they should be and getting all their needs met with the right diagnosis, the right treatment, and the right support. All right, so today I'm talking about ADHD because I thought, you know, how many of y'all are educators? All right, how many of y'all are parents? Okay, good. So hopefully there's some interest in how do we treat this holistically. And I think it's a great topic for me to actually kind of spitball back and forth between y'all, because how often does your doctor, does a pediatrician call you? Are you getting, Jeff, you're a 6th grade teacher, are you getting called often?
No, I just talk to you all the time.
Okay. So I also want to know how I can help support you guys with your students who may be struggling or experiencing some of these symptoms, okay? All right, so who here has met or seen someone ever with ADHD, or they suspect? Okay, perfect. What are some symptoms of ADHD? Everyone gets a gift if they get something right. I got them right here, because otherwise it's going to be really boring. Hyperactivity. Hyperactivity, who said that? Okay, anyone else? Inattention. How does this, tell me again?
Impulsivity.
Impulsivity. How does this show up in a classroom?
Wild.
Wild. Emotional outbursts, thank you. That is one that is missed a lot of the time. Fidgeting. And blurting out. Another one is emotional sensitivity, feeling extremely upset with any perceived type of criticism, okay? So as you guys know, this is extremely problematic in the classroom, in other areas of life as well. So, why are we thinking about this holistically at all? There's plenty of medications. Have you guys heard about any medications for ADHD? Okay. Yes, sir. What is one? Tell me again. Focalin. Does anyone know what Focalin is?
It's not, is it a non-stimulant?
It's a stimulant medication. That's right. Okay, yes. Any other medications y'all have heard of? Concerta. Who said Adderall? I did. Okay. Yes, so these are all stimulant medications. They have a lot of side effects, right? Side effects like weight loss, difficulty sleeping at night. Sometimes if the dosing is very high, you'll get a flat affect. Some people don't feel themselves on them. So there's a lot of things with these medications, yes. Loss of appetite, yes. Weight loss is a huge problem, especially for pediatrics. If we're not growing well, we're not developing well. So these can be very problematic. So we need to look at how can we treat these things in a way that we may not have to use medication, or if we do, that we're having less side effects and lower doses, okay? There's also non-stimulants, we'll talk about that if we have time at the end here. So other things that we're gonna talk about today are how holistic care comes together. So we're using nutrition, we're using exercise, we're using outdoor play, we're helping emotional regulation, we're looking at sleep quality, nutrition with blood sugar balance, gut health, micronutrients. Anyone know what a micronutrient is? Micronutrients are minerals and vitamins, okay? So your macros are your proteins, your carbohydrates, and your fats, and your veggies, and all of that, and then your micros are your vitamins and your minerals, okay? We're gonna look at the environment. So are there things that are happening like, oh my goodness, does anyone have kids that are on screens a lot? Is that like an issue for y'all at all? Did you guys know the average length of time for kids to be on screens is 6 to 7 hours per day? Per day. And I can attest to that because I do ask. And it comes out. Not just schoolwork. We're talking about after hours. And it has an effect, as I'm sure you guys are aware. So I want to ask, how can we stop suppressing symptoms? How can we, figure out why the child is struggling? What more is going on? What does their body need? So we're going to talk about one of my patients. I'm going to call him Brady. That is not his name. We cannot disclose any private information, of course. Brady came to me. He was 2 years old. And Brady has ADHD and autism diagnoses. He was completely nonverbal. I could not examine Brady at all in the office. His mom could not take him anywhere. He spent most of his days screaming, banging his head, uncomfortable, and running around very energetically, okay? He didn't go to the bathroom, number 2, but every 14 days. His pediatrician said, there's nothing more we can do. You need to maybe do some ABA therapy, Mom wasn't even sure he had autism at that point, wasn't even told that he maybe had autism, and was just said, go to AVA. And she was like, okay, well, what's even going on, right? So she felt like she wasn't getting the care that she needed, and she came and saw me. So we're going to show you some of his testing. So what I did is I did some functional medicine testing. Anyone heard of functional medicine before? Ma'am, what have you heard?
Doing what you're going to describe, which is all the things about how our body metabolizes things, how our body is activating, and the proper things that we're supposed to be doing, like pooping every day.
Yes, because if you're not pooping, you're not detoxing, we're going to talk about that. Okay. So you're right. Functional medicine is a way to look for the root cause of some of these problems. In particular, it's looking at biochemical pathways in the body. It gets a little bit complicated if you haven't worked with those chemical pathways before, but I'm going to kind of walk you through it and show you kind of what I do. So one of the tests that I do is called the urine organic acids test. I know, it's riveting. Absolutely, other than me, I don't know who's interested in this stuff except for some of the functional medicine doctors out there. So this is a way that we can test different biochemical pathways in the body. It's a urine test. So it shows us how the body is metabolizing things, all right? In particular, let me give you an example. I think this will make it more clear. Anyone had a blood test for vitamin levels before? Okay, yeah, all right. So maybe like a B12 or an iron level, something like that? Yeah. So that's great. That tells you how much iron or B12 you have in your blood. Sounds amazing, right? But it doesn't tell us anything about how that vitamin or mineral is used in your cells or tissues. We don't know if the B12 is getting in. We don't know if the mitochondria, which is the engine of the cell, is using it for energy. We don't know if it's running any of the chemical reactions. We don't know if the body's able to use it as a building block for neurotransmitters. Anyone heard of a neurotransmitter before? That is a hormone in your brain. You might have heard of like serotonin or dopamine, the focus chemical. Okay? So we don't know if your body's able to even make dopamine. What if you can't make it? All right? So this helps us look at that. It also helps us look at a number of other things. Inflammation in the brain, gut problems in a different way than a different test I'm going to show you later, nutritional deficiencies, whether we're able to detox from toxins that are in the environment. There's millions of toxins, as we know, even in breast milk, which is terrifying, but they're everywhere. And it helps us identify if there's any tissue damage in the body. Okay, so let's take a look at this 2-year-old. I suddenly wish I had a pointer. There's a lot of different markers up here, and I don't want you to get too overly hung up on this, okay? But at the very top, we can see where it says malabsorption. That means what? It means I'm not digesting food well. Well, if you don't digest food well, you can't even have the chemicals and building blocks, the proteins and whatnot, to build these different things in your body. Okay, because literally we are what we eat, right? So nobody would go to a construction company and say, hey, can you build my house out of gummy bears? I mean, you would literally just like leave, you know, if someone told you that, right? And yet we expect our bodies to be able to run efficiently without absorbing food well or being fed the right type of food, okay? So you can see this marker phenylacetic acid's off the chart. He's not absorbing well. And then we can look here and we see these dysbiosis markers. In the body, we have something called our microbiome. Anyone heard of a microbiome? It's kind of big right now. Okay, tell me more.
Well, our stomach, we have all these parasites, I mean, not parasites, good bacteria in our body that is doing all kinds of things for us that we don't have to do, but we have to make sure that they don't get knocked out.
Right. So in our gut, there's a good balance. There's a balance of bacteria. And when I explain it to patients, I say good bacteria and bad bacteria. That's not exactly true. There's bacteria that lives in our gut at all times. And what we don't want is a certain part of those bacteria to overgrow and other bacteria to be depleted. And when we have that situation, we call it dysbiosis. That causes inflammation. When we have inflammation in our gut, we have inflammation where? Everywhere else, including the brain. Because our brains are actually connected. We have this thing, it's really complex, you know, right here. It's called the neck that joins our body and our brain together. So it's not separate, right? So anywhere you have inflammation, including in the gut, you'll get inflammation in the brain. So this is really important, and you can see his hydroxyphenylacetic acid, say that 20 times, which is the third one down, is off the chart, okay? Benzoic and hippuric, this is a detox pathway, we'll talk about that later. And right here at the bottom, yeast. See this one called diarabinitol, that first one under the yeast marker right here? He has a massive yeast infection in his gut. So he's just got yeast growing and growing and causing inflammation, okay? So we need to take care of that. On the right side, where it says vitamin markers, these are all to do with B vitamins. So I drew a B level on him, a serum. It was normal, okay? Completely normal. But as you can see right here, his alpha-ketoadipic acid, his alpha-ketovaleric acid, his alpha-keto-beta methylvaleric acid, these are all metabolites, B vitamins. They're off the chart. He's not using those, right? He's peeing them out because this is a urine test, okay? So he's excreting it all. It's not getting into his cells how it should. So he can't even make the neurotransmitters that he needs because, in particular, dopamine and other ones in our body, we need B vitamins, okay? Anyone own a car? Anyone know how the engine works? Okay, sir, in the back. What happens if you don't have spark plugs, but you have gas?
It just dumps fuel, but you can't ignite it.
So is your car running?
No.
So you have like a lot of gas and you're just sitting there because you have no spark and you have nothing to light it? Yeah? Okay. Same with our bodies. That's what vitamins and minerals do. That's why we're screaming all day about like eat your veggies, you know, when you're 3, okay? If you don't have B vitamins, you can't turn the car on. You can't build these things. It's the spark that makes it go, the chemical reactions, okay? All right, methylation markers, these are also B vitamin markers. There's a lot we could say about MTHFR, that's a different lecture. Same with biotin, that's also a B vitamin. And you can see nothing, you know, peeing them out. All right, this is another part of his test. This on the left is to do with how he's processing energy in the body. Okay, in our bodies, we all have this thing called the Krebs cycle. Has anyone studied that in high school biology? Yes, we have one person. Anyone take biology? I know. Who remembers this stuff? No one. You look at this like once and then you're like, I don't remember. The Krebs cycle is how the body makes energy for us to go. So our body breaks down carbohydrates, proteins, and fat where? In our gut. That energy, that food, gets put inside our cells. Inside our cells, we have another little organ called the mitochondria, which is the powerhouse of the cell. And in there, we have a bunch of little chemical reactions that occur in a little wash cycle. And at the very end of it, we spit out energy, okay? Energy in the body is called ATP, adenosine triphosphate. Just a fancy word for energy, it doesn't really matter. So what we can see here, fat, that's the first one, under cellular energy, he's doing all right. He's like, all right, fat makes me happy, feed me some fat, I'm doing okay. Carbohydrates, this kid is not processing sugars and carbohydrates well at all. And in fact, his mom is like, yeah, I wondered if he had celiac disease or something, because every time I would give him this bread, this like supernatural bread that we would buy, he would be off the chart, just running around the house, screaming like crazy, okay? So this lines up with his symptoms. Down here is his energy metabolism. Obviously, he's not able to produce energy well because he can't absorb his carbohydrates well, okay? Why is protein not here? The test likes to hide the protein under the B vitamin things. It's a bit complicated. He wasn't processing that well either. Over here, This is to do with inflammation in his brain. So do you see this kynurenine marker right here at the top? That means inflammation in my brain, okay? So whenever we look at that, we kind of think, what in the world is going on? You see the second one down, quinolinic acid, it's bright red? His brain's on fire. Why is his brain on fire? His gut's on fire. Do you guys remember how we talked about if you have inflammation in your gut, you have inflammation in your brain? So we need to fix that, okay? Over here, we've got some catecholamine markers. This is to do with adrenaline and noradrenaline. He was hanging in, okay? His serotonin marker, though, who knows what serotonin is? Anyone have ever heard of SSRIs? Okay, do you guys know why we take SSRIs? Anxiety depressant, yeah. And why is that? That's because serotonin's our happy, calm chemical. So we're taking a serotonin, selective serotonin reuptake inhibitor, which is a super long word saying serotonin is stored longer in our brain. So we're happy and calm, okay? He's producing it, but he's peeing it all out, okay? It's not staying. So he's just irritable all the time, okay? Toxin markers, he's hanging in, but he's got a little bit of, he's not getting rid of all the junk, not very well. Why is that? That's because he's having a lot of input, okay? So this particular family didn't have much experience with holistic health. They were eating a lot of non-organic food. They were spraying Roundup. They were using gross chemicals that have toxins. And also, let's be honest, there's toxins everywhere. All right, this is the last one, I promise. Okay, I just want to show you this. Oxidative damage. Has anyone heard of oxidative damage at all? Has anyone heard of antioxidants? Okay, yeah. So a lot of times we talk about oh, you got to get your antioxidants to be healthy. And we're all like, okay, that sounds great. But when you think about it, you're like, well, what does that even mean? Right. What even is an antioxidant? What is it even doing? I don't know. So when we have oxidative damage in our body, what that means is any chemical reaction that happens in your body produces what's called almost any reaction. No one get mad at me when they find the one that doesn't. Produces free oxygen species, okay? You can imagine these as little bullets. They're little bullets being shot out of machine guns at your cells, at your DNA, at your mitochondria, and they're just poking holes in everything, okay? And this is what cancer doctors get kind of excited about, right? Because if you have DNA damage, what happens? Okay, we're not gonna jump in. If we have DNA damage, we can get cancer. Yes, because the cells go crazy, right? Okay. So we need to neutralize the reactive oxygen species, okay? So we need to bring in another army to get rid of the old army. It's kind of like, well, I don't know. I don't know anyone's politics, and I'm not trying to bring politics into it, but let's say you're in Minnesota and you brought in the National Guard to get the ice out, okay? Same thing, all right? So we need to eat antioxidants. Antioxidants come from what? Fruits, veggies, all of those good foods, okay? If you don't do that, you're getting tissue damage. If you have tissue damage, your body is literally falling apart. That's where you can get a lot of illnesses like cancer, ADHD, depression, anxiety. It's not the only thing, but it's part of it. His lipid peroxidase, this is a sign of what's tissue damage in his body. It's off the chart. We're off the chain here, okay? We've got to fix this. This kid is miserable.
Is that also from a urine test?
Yes.
Okay.
Okay, questions on the metabolomics. That was so much information. Is anyone glazed over? Does anyone need to leave the room and exit through the back door yet? Potty breaks? Okay. We're going to move on. The other thing that we like to look at, as I said, is gut health. Okay, so we already kind of looked at one test that looks at gut health. We're going to look at another test. This is called the GI map. GI map is a DNA test. Okay, it's DNA PCR. Anyone have one of those gnarly COVID tests where they jammed the thing all the way in the back of your throat? It was the very first kind. It was called the NP test. I had a lot of them because I was working for a different company, so I had to get them on the regular. They were great. Jeff, did you enjoy getting those? No. Okay. All right. Very painful. That was a DNA test. Okay, same thing. Although this is poop, so we're not jamming anything up any baby's noses. Thank heavens. And it helps me see if there's any pathogens. Pathogens are bacteria, viruses, parasites, worms, anything that's creating infection in the body, okay? This test also helps me look at how well they're digesting food and if there's any alarm markers. So anything that might make me say, oh my goodness, this child needs to go see GI, and heaven forbid they might have Crohn's disease, ulcerative colitis, something more going on, okay? So we're gonna look at Brady's test. This is actually his commensal bacteria. Commensal bacteria are, remember when we were talking about the good bacteria and the bad bacteria? This is what I usually refer to as the good, okay? How's this test look to you guys? Thumbs up, thumbs down, yeah. So we can see it's all in the red. Where are his good bacteria? I don't know. Now, granted, this child also had some food issues that we needed to work on. Anyone work with children who are on the autism spectrum, who have trouble eating food? Yeah. So it's a lot of work, right? It's not just an overnight snap your fingers, oh, diversify their diet, and parents are looking at you like, you're joking, right? That's not how it works. That's not how it works. All right, dysbiosis, opportunistic infections. So these are infections that start to overgrow when the good bacteria goes bye-bye, okay? Would you guys agree that this test is fine and we should just send them on their way home? No, we see everything's in the red, right? All kinds. He's got strep infection, staph infection, bacillus infection, enterococcus, methanobacter, anyone gassy, that'll cause it. Inflammatory autoimmune related stuff. I mean, just, this is wild. No wonder he wasn't feeling well. His gut's on fire. Cryptopyrroles. When you guys saw this right now, did you think this was like something your weird cousin wanted you to invest in? Like Bitcoin or something? That's what I thought when I saw it. I was like, what are y'all talking about? No, this is actually to do with the way our body processes heme. Have you guys heard of heme in the blood? Anyone heard of that? Heme's the thing that carries like oxygen in the blood. It's in our red blood cells. Some people have a genetic defect that doesn't work very well. It's called cryptopyluria or pyluria. It's a urine situation where you test urine and see if this is happening. Normally, under normal circumstances, it's not a big deal. You're not going to get harmed from having a bunch of these pyrroles running around. The issue is, in kids with some of these symptoms, it's a sign that they don't have enough B6 and zinc in order to do this process correctly. And again, remember how we talked about neurotransmitters and you need the B vitamins and all of that? Yeah. So if you're not getting this, the B6 and the zinc, because of this genetic defect and you never test for it, you can be on 60 milligrams of Vyvanse and you're still not going to focus, okay? Plus you probably won't sleep or eat. This is this little guy's test. It doesn't take too much to interpret the test. The numbers are right here. If you're above 16, you have this problem. He was what, 24. 24.24. So we have to fix that, okay? All right. Hair toxins. This test tests for heavy metals and it tests for toxins in the body. I mostly use this test to look at two things. Lithium, dietary lithium, not the type of lithium that you would think about for someone who has bipolar disorder. Totally different thing, okay? People with bipolar disorder are taking about 150 to 300 milligrams of lithium a day. There's a lot of side effects, okay? That's not what we're talking about. We're talking about what you get normally from your diet, so 1 to 3 milligrams. If kids don't have enough lithium for whatever reason, they get a lot of behavioral problems, okay? Not as bad as someone, you know, you're not thinking like, oh my goodness, these highs and lows, like rapid cycling, like bipolar, but definitely a lot of up and downs emotionally, okay? The other thing I tend to use this test for ADHD is copper and zinc. When those ratios are off, it's like a seesaw. One goes up, the other goes down. Things get really out of whack, people can't focus. So sometimes we'll have to give some zinc to kind of take care of that. So that's what I usually am using this test for. In this case, let's take a look. In this case, he actually had some pretty good aluminum and some pretty good titanium. There's different sources for this. So aluminum cookware, well water that wasn't tested, that was the case for him, okay? But there can be other toxic chemicals. Now, sometimes you'll see some kind of fringy stuff where people will do metal chelation. We don't want to be doing that in children. That's not safe, that's dangerous, okay? So you'll see these people that are doing like IVs to get all the metals out of the body at once. That's not what we want to do, okay? What we do want to do is identify the source, get rid of the source, okay? If we're getting too much metal in our body, it's not a good thing. And then maybe do some gentle things to support our liver, because our liver naturally detoxes, okay? This one, I think the main issue here, if I remember correctly, his lithium wasn't too terrible, but his copper-zinc ratio was just a little off. So we're looking at a ratio, we're not looking at these exact numbers, but I just threw it up there so you could see the copy of the test. All right. So sometimes I get people that are real excited about supplements, but not real excited about changing their lifestyle or their diet. Anyone here like really get resistant, you know, right around like Christmas about that new diet they wanted to start? I'll raise my hand, okay? I always tell everyone, supplements are supplemental, okay? If we don't have our foundational building blocks, there's no point. You will never get there, okay? If you're drinking 32 ounces of soda and puffs and French fries and Chick-fil-A and I don't know, ultra-processed foods, gummy bears, and Tic Tacs, your body is not going to function if you take a good quality multivitamin, okay? And it sounds really simple, but let's be honest, it's hard. And it's even harder with kids, right? It's not like, oh my goodness, snap my fingers, okay? So this takes a lot of work. And I talk about nutrition over and over and over and over for months because it's not just something that we're fixing on day one, and it's certainly not something we're fixing with people that have sensory issues around food on day one. But we have to address it, and we have to help people find ways. Most frequently, I'm usually referring out to my friend Stephen Kempler at Whole Family Therapy, if you all know him. He's fabulous. He does SOS feeding therapy for kids that are really struggling with picky eating. Okay. Now, if it's just a kid that maybe is having a food jag or having some issues where they're kind of like, I don't want my veggies, but I will eat the peanut butter and jelly, but I don't want it today, but I will have chicken nuggets, and people are turning into a short order chef, sometimes we just have to like figure something out, okay? And that's like a different thing than people that are having real struggles with those foods. And we can link foods together, one food to another, to help those kids eat a little bit more. But it's a process, and it's work, and all the rest. But again, you don't want to spend $300 on vitamins if you're not eating well. It's not going to work. Parent coaching strategies. This is where I want to ask you guys. You guys are educators and parents. What works? What doesn't work? What do you guys advise your parents in the classroom who are struggling with hyperactivity, inattention, impulsivity, emotional outbursts? Anyone work with a parent coach before?
I mean, I think
Yeah.
Starting at home is just kind of checking in about systems that they have. Yes, so all there. I
Yeah.
say that, and then I don't really check my own at home. But.
That's fine. Sometimes we have expertise that we don't use ourselves, and then we're like, oh, right?
Now that my daughter's 10, I'm starting to pay attention.
So tell me more. I would love to hear this. So systems.
Well, I think, she has been recently diagnosed with ADHD, and
Yeah.
I see her, and she's started to struggle a little bit more with school as it has gotten a bit more complex. And so I think, coming in when her stuff is all over the house, it's like, no, you walk in, your lunchbox goes here, and really holding your coats here, you know, just having systems like ordering in the morning just saves a lot of, because she has the emotional breakdown component. So the
Yes.
systems are starting to help family dynamics in a lot.
Yes.
Yeah.
100%. So organizational strategies that reduce overwhelm and help a child know these are the steps. Visual cues, sometimes for younger kids, no more than 3. Who here has children that can't remember the third thing you just said? Yeah, right? We don't want to give so many directions, okay? Anyone not learn how to be a parent from their parents? I'll just speak for myself. I won't call anyone out, don't worry. You won't be on camera. Yeah, we're not born knowing how, okay? No one's born knowing how to be a parent. That would be fabulous. Wouldn't that be great if you're like, oh, suddenly I'm Dr. Becky. I got it. Does anyone listen to Dr. Becky? Oh yeah, she's so good. So sometimes, on occasion, I'll run into parents that just have some unskilled parenting. Not just, but a lot of other things are involved, right? But if we also have unskilled parenting, and we're not able to parent in our way that their neurodiverse child can respond well to, it can be really difficult. Also, you can be an amazing parent, have 4 kids, and your 5th one is neurodiverse, and every strategy that you tried before, it doesn't work. And you're like, wait, I thought I was gonna get like an award, like a medal. I was doing so well. And now I've got this kid that's like crying and kicking, and I can't get him to school, and I'm just like, I don't know what to do. So sometimes we do need to bring in parent coaches, okay? And that's what they're here for. I, in particular, like the heart-nurtured approach. I don't know if you guys have heard about that. It's a great one to look up if you haven't. Okay. So these are all things that we need to look at in the 360-degree view. Relaxation techniques. Now, I about have people looking at me cross-eyed when I talk about relaxation techniques in little kids, especially when they're 2 or 3. Do you guys have relaxation techniques that you do here at Carolina Day? Okay, give me some techniques. I'm going to call on someone who's nodding.
Different sorts of breathing.
Breathing, yes.
Breathing activities.
Breathing exercises, box breathing, blowing out the candle, 4-7-8 breathing. All that? Yeah. Okay, perfect. What else? Does anyone do relaxation for themselves? I hope so. Otherwise, I can give you a consult for adrenal fatigue. I got you. Art. How many people know kids that like to color? Me too. A lot of kids who have ADHD have some amazing creative abilities, okay? It doesn't mean that this diagnosis, if you have this label, that you will not be successful. A lot of kids are very artsy, very creative, and sensitive, okay? So incorporating art, incorporating journaling with art, incorporating music, all of those things can be very relaxing to the nervous system. Anyone exercise or do yoga? Do you feel relaxed for the most part? Yes. Kids love it too. So this is another relaxation technique that we can do, okay? All kinds of free stuff on YouTube. I know screens. That said, sometimes we don't know what to do. So, you know, for that 30 minutes, maybe put on the yoga video, okay? Who's heard of progressive muscle relaxation? So it's a way that we tense up each part of our body to help us relax. This in particular really helps with kids who can't sleep. A lot of children who have ADHD type symptoms really have a hard time sleeping, whether they're on medication or not. So what we're doing is tensing each muscle really, really, really tight, and we're going through each one at a time right before bed, okay? So these are some other ways that we can help. Now, young children who are really little, like 2, about the best we're probably going to get is blowing bubbles in their milk, blowing bubbles with the mixture-y stuff, make the non-toxic one. Outdoor play, very calming for the nervous system, very calming in ADHD. Unstructured outdoor play, okay? So this is time where our bodies can regulate, touch the earth, touch the world around us. We're not being told what to do. We're not in an organized sport. We're just in nature enjoying life. And it's very, very calming to our nervous system, which all kids need, and in particular children who are neurodiverse. Medication. Now, people ask me this all the time. Have you hung up your prescription pad? I have not, okay? I'm an integrative doctor. I try to do the most natural things first. Sometimes we do all the natural things, and kids need a little something still. But what I do see with those kids is their doses are markedly lower. I'll give you an example. I have another kid in my practice. I'll call him Bob. I don't know why, that's my dad's name. He came in on, I think he was one of those 60 milligram Vyvanse kiddos, okay? Couldn't sleep, wasn't gaining weight, nothing. Like, parents were just beside themselves. He was kind of a zombie, still wasn't getting his work done. We did all of this stuff, right? All of it. I took him off all his medication, doing a lot better. And parents are like, you know, I think we could try a little. We could try a little and just see. He's on 5 milligrams in the morning, 5 milligrams in the afternoon, focuses all day, goes to school, gains weight, he had lost 20 pounds, and now sleeps. So I'm going to take that as a win, okay? There are also non-stimulant medications. They have other side effects, depending on what you've seen. Clonidine is one that helps mostly with hyperactivity. It also makes kids really sleepy. Guanfacine also helps to some extent. It's a little bit, you're a little less sleepy. They don't have as dramatic as effect as the stimulants. They also have to be weaned on and weaned off, so you can't just stop them. There's other ones you can use, antidepressants and all the rest, but those are kind of the last resort. So like I said, I integrate all these together. And I want to tell you about my patient, Brady, now. I just got a video from Brady's mom. He's almost 3 now. He was sitting at his table, at his little desk. They homeschool. He was tracing his letters. He said, "Hi, Dr. Ellie." He's going to the bathroom every day. He goes to parties. Yes, it's not his favorite. He will go. Mom can go to the grocery store. And he's developing. So I'm going to take that as a win. And I think his mom does too. Okay?
Was it mostly nutrition? Did they change their habits completely?
They've changed everything. So they've changed the way they eat. They've taken him off gluten and dairy, which he was sensitive to. Food allergy testing is for another lecture. Sometimes we do that. But you never want to do that until you've treated the gut. Don't just order a food allergy test. If you see those food allergy tests online, don't just order those. You're going to get crazy things, okay? Crazy results. They got rid of all their environmental toxins. They completely changed their sleep routine, which was out of control because this poor child couldn't be alone because he was in so much pain because he didn't poop but once every 14 days, despite the Miralax and the stimulant laxatives and everything else that he was given, lactulose. He's not taking any medications for pooping anymore, okay? So I think this is a better approach, and I hope that you agree, and I hope that you found it helpful. And I would love to know from educators, from you guys, what do you need from me? What can I tell parents? You know, what are the supports that they should ask for? What should I tell them when they say, what should I tell my teacher? What's helpful to you? What's not helpful? And I would love to end with that. You're welcome. Round of applause for all of y'all. Good job, educators and parents. Thank you.